Since 1788, when European settlers arrived in Australia, the Indigenous population have been subject to much discrimination based on their appearance and way of life. To this day, Aboriginal and Torres Strait Islanders still face discrimination and disadvantage from and in comparison to non-Indigenous Australians. Many of these disadvantages are often established before birth, with 3 in 10 Indigenous people, including pregnant women, reporting barriers to accessing healthcare. It is also reported that up to 50% of pregnant Indigenous women smoke while pregnant, and 1 in 7 Indigenous mothers suffer from postnatal depression. Furthermore, Indigenous children are 2.5 times more likely to be born into the lowest income group, as well as having a 1 in 2 chance of living with only one parent in contrast to the general population. Statistically, Indigenous Australians experience a shorter life expectancy, poorer health, lower levels of education and employment, and tend to live in more rural and remote areas. By being born into these conditions, Aboriginal and Torres Strait Island children are already predisposed to a life of disadvantage. Through experiencing these disadvantages as children, the likelihood of experiencing mental health issues as an Indigenous adolescent or adult is significantly increased. In correlation with mental health illnesses, there is also a heightened inclination towards health risk behaviours, such as substance abuse, among the Indigenous population. Mental health stigma impacts many areas of an individual's life, such as self-perception, housing, employment, relationships, mental and physical health, as well as accessing mental health services. Stigma is defined as the discrediting of one's identity, behaviour, or status. Negative stereotypes represent society's expectations towards a stigmatized group. Mental health stigmatization occurs when public perception on an individual's mental health cues are influenced by stereotypes, resulting in discrimination. Many Indigenous Australians have reported that the stigma surrounding mental health has been a barrier in accessing mental health services. They report feeling a sense of both public and self-shame. It is feared that their mental health issues will be exposed to their community and they will be punished and judged. It was also stated by members of the Indigenous population that even if necessary mental health services were readily available and easily accessible, the stigma associated with mental health issues will still cause a lack of participation. Perhaps a way to address mental health issues in Indigenous communities constructively is to take a community and cultural-based approach to promote mental health awareness and education. For example, community centres can run workshops which educate the community about mental health issues. Furthermore, more Indigenous people should be employed in mental health services in these communities. Through training and employing more Aboriginal and Torres Strait Islanders in mental health services, the community will be able to feel cultural safety when accessing these services. By providing cultural safety for Indigenous people with mental health issues, they are more likely to reach out for help. Indigenous healthcare providers are able to empathise with the Indigenous community, thus improving participation in interventions and programs.